Well, good morning. We're gathered here today on Treaty 6 territory, and I want to acknowledge the Métis people who share a deep connection with this land. There is a healthcare crisis in our province. Now, Danielle Smith claims otherwise, but we continue to hear daily from Albertans who know she's either completely out of touch or deliberately misleading the public. Rural emergency departments continue to be forced to temporarily close because of staffing issues. A backlog in cancer treatment means that Albertans like Brian Message of St. Albert are having to wait months to see an oncologist for treatment for lung cancer. And finding a family doctor is still impossible for thousands of Albertans, including Edmontonian Mona Koch, who lost hers in a lottery in November after being with her doctor for 8 years. And this while the UCP are forcing the closure of clinics in communities like High River. You should not have to play the lottery to get health care in our province. But I come today before you with evidence that this crisis runs even deeper than we've seen. As data from the Government of Alberta's own website shows, Albertans are waiting far longer than they should for the surgeries they need, while Danielle Smith and the UCP continue to divert public resources to private, for-profit surgical companies. After 4 years under a UCP government, the number of Albertans waiting for surgery has risen. According to their own data, in May 2019, more than 70,000 Albertans were waiting for surgeries. As of February 2023, that total number has increased to 74,000. From April 2019 to January 2023, the median wait times for hip replacements have increased from 18.7 to 26.3 weeks, and knee replacements have increased from 20.6 weeks to 36.9 weeks. The number of cancer surgeries performed in Alberta was also lower in 2022-23 compared to 2019-20. That's right. A growing population and still fewer Albertans are getting cancer surgery every year. Frankly, that's horrific, and it needs to change. The UCP's legacy on healthcare is one of complete failure, chaos, and risky fights with frontline workers. And rather than admit their failure, we see clear evidence of the Premier advancing a plan to dismantle public healthcare and move to private for-profit healthcare that will leave so many without the access they desperately need. Now, those listening today, you don't have to take my word for it. I would strongly urge that you take a look at what Calgary lawyer Susan Wright found in her recent analysis of the contracts awarded to chartered surgical facilities, private for-profit surgical businesses. Susan found that these chartered facilities receive simpler cases than hospitals. Indeed, that one particular company indeed has a volume floor, so that's a minimum number of surgeries that AHS has to send them every year, and that they are receiving $167 million directly in service fees on top of the usual fees billed by surgeons and anesthesiologists. In other words, AHS is required to ensure that these private for-profit companies make a profit by guaranteeing them a minimum number of customers each year, even if those surgeries could be performed cheaper in a public facility. Additionally, internal Alberta Health Services documents from the summer of 2022 show that the UCP's prioritization of private facilities is not effective. The gap in the number of surgeries that public facilities could have completed but couldn't due to staff shortages is in fact greater than the number of increased surgeries that have been done in private facilities. And now, as the health minister recently admitted, the UCP are actively mandating key healthcare workers like anesthesiologists to go to work in private for-profit surgical clinics. And since, as the health minister also acknowledged, there's been no net gain in anesthesiologists since last year, that means shortages in public health care facilities will continue and may potentially get worse. So it's clear. The UCP have not lowered wait times for these surgeries, period. They're intentionally cherry-picking data. They're only providing numbers dating back to November 2021, when the wait list for surgeries grew to over 85,000 as a direct result of their experimental best summer ever, in the midst of the pandemic that proved to be an outright disaster for public health. And now it appears that with the election on the horizon, they're actively interfering in the healthcare system in an effort to try to rig the numbers and hide the truth. Albertans can't trust Danielle Smith and the UCP with healthcare. They've only made the crisis worse, even as they continue to claim that there is no crisis at all. We should not be forced to accept that our friends, family, and neighbors are being diagnosed with potentially life-threatening illnesses and then simply sent home to wait for months for treatment. We should not be forced to accept that Albertans can't find a doctor or that rural communities don't know from day to day whether their local emergency room will be open when they need it. We should not accept that healthcare workers are being worked to exhaustion, burning out, and then choosing to flee the profession because they see no hope of better under the UCP. We should not accept any of those things. We should demand better. Better health care, faster access, and a real plan to end this crisis once and for all. And an Alberta NDP government led by Rachel Notley will end the crisis in health care. We will introduce our family health team strategy that we released a few weeks ago and that has since been supported by so many across the medical communities. We will empower more healthcare workers to work to their full scope of practice and provide support staff so physicians can spend less time on paperwork and more time on patient care. We'll establish one-stop shops for the healthcare families need, and the clinics these family health teams work in will do wonders to ease the pressure on emergency rooms, on EMS, and on operating rooms. We will bring healthcare back into the community. And in doing so, we'll provide quality healthcare to 1 million more Albertans. And yes, that includes timely access to a doctor. We will prioritize workforce recruitment and retention built on a foundation of respect for healthcare workers so they can see a better future here in Alberta for them, their families, their friends, their neighbors. And we will increase surgery capacity throughout the public system, public being the key word. Albertans don't have to accept a crisis in healthcare. They're demanding better. And an Alberta NDP government will deliver better healthcare for Albertans. Thank you. I'm happy to take any questions.
Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. We're going to start in the room.
I don't know if I have to say my name. I'm Catherine Gurkowski, Alberta Today. So the government has issued a statement, and they said as of March 27th, they're actually at 115% of pre-pandemic surgical volumes, which is up from the 90-day report on February 27th when they're at 109%. Why do you think they're headed in the wrong direction if it looks like the numbers are actually going up?
So again, the government is choosing to cherry pick very particular numbers in very particular situations to create a false narrative out of their desperation ahead of the upcoming election. The numbers on their own website show that the total number of Albertans waiting for surgeries has increased from 70,000 to 74,000 in 2019 to 2023. Their numbers show that the median wait times for hip replacements have increased significantly for hip replacements and knee replacements. These are their numbers from their website. So they're choosing, in many cases, to go back to just to November 2021, when we were at the height of the pandemic. But it's quite clear we are not achieving what the UCP claims we're achieving, and we are certainly nowhere near the grand claims that they made when they began this push for a massive increase in private profit in the public healthcare system.
And another thing they said, they're looking to expand the anesthesia care team model by using alternate providers to address the gaps. What, if anything, do you think about that? Instead of using anesthesiologists, using other practitioners?
So I had a lengthy discussion with the health minister about this at Health Estimates earlier. So let's be absolutely clear. Anesthesia care teams are a very particular model where you have specially trained respiratory therapists who are in the room supervising patients who've been put under. And they are supervised then by an anesthesiologist. This is currently only done in a few select areas in Canada and only done for the most basic surgeries and not for full sedation. So that's something that you could perhaps bring in and utilize to increase cataract surgeries, which really aren't a problem right now. The government has seen an increase on those. That's the lowest hanging fruit. It's the simplest thing. It does not require an anesthesiologist. But if the government is saying that it intends to significantly expand the number of surgeries by using these anesthesia care teams in full sedation, in orthopedics, hip replacements, knee replacements, that is a significant difference. And so far, none of the conversations I've had with respiratory therapists or anesthesiologists in Alberta give any indication that this government is anywhere close to being able to do so. So I would say the minister, if he is claiming this is his fix and this is his solution, that is a figment of his imagination and about as real as all of these other claims they're making.
Thank you. We'll go to a call from the line now. Laura, your line is open.
Hi there, Laura Krause with City News. A little off topic, but the Canadian Resident Matching Service, they recently released data that shows there are 42 unfilled family medicine residency positions in the province. And that's compared to only 2 unfulfilled in BC and none in Saskatchewan. I was just hoping to get your response to young doctors not wanting to come to Alberta.
Absolutely. I've seen those numbers, and I've had a chance to talk with many physicians and indeed some folks that work in some of our teaching institutions since those came out. And they are abundantly clear. This is directly because of the UCP's decision to go to war with doctors back in 2020. These young students that are now seeking residencies this year, they were beginning that process. They were watching their government essentially nuke family medicine. They saw the damage that it did. They talked to preceptors. They saw people who were being affected and impacted by this, and they are voting with their feet. Now, the government is trying to dismiss this and play this off, saying, oh, it's a blip on the radar. No. Ask any doctor. Ask any instructor of doctors. They will tell you this is because of the mismanagement, the attacks, the outright hostility of this UCP government. They're making some nice noises now, and they're trying to play games and put some pretty things in the window, but let's be clear. Doctors don't trust this government. Young doctors don't trust this government. Albertans should not trust this government when it comes to health care.
Do you have a follow-up, Laura?
No, that's all. Thank you.
Thank you. We'll go to our next caller. Your line is open. Lisa, your line is open.
Hi there, this is Ray with Edmonton. I'm also looking at this data that the province provided us this morning. It says 62.1% of patients who are currently waiting are waiting within recommended wait times. I know you said those wait times have dramatically increased, but can you tell me what are the reasons for that increase and what's the solution right now?
So the main bottleneck in the surgical system right now is a lack of the staff we need to perform surgeries. We have a shortage of anesthesiologists in the province, and indeed, I asked the minister at estimates last year how many anesthesiologists we had practicing in the province, and then I asked him again this year, and he essentially admitted there has been no net growth. We don't have a single new well, we've gained some new anesthesiologists, but we've clearly lost them as well because we have no net gain. So that means we have no additional capacity in the system. And that is because of this government's attacks on physicians. I have spoken with folks at the Red Deer Regional Hospital and other facilities across the province who have been actively working for years to try to recruit new anesthesiologists. And they have told me that many have turned down the opportunity and chose to go to jurisdictions like BC and others specifically because of the behavior, the attitude, and the mismanagement of the UCP government. So the fact is, we are not going to see an improvement in wait times. No matter how much this government signs sweet contracts for private for-profit surgical facilities, guarantees them Albertan surgeries, potentially at the cost of our public facilities. None of that is going to move the dial 1 inch until we are able to get more anesthesiologists and more operating room nurses available. We're not even making full use of our public surgical facilities at the moment while this government is signing these massive contracts to send patients out to privately owned for-profit facilities. So that is the crunch. This government can play with numbers. It can try to jig the system however it likes. But the fundamental truth is this government deeply undermined our public health care system. They created incredible chaos. They drove professionals out of this province. And if we want to get things stable and back on track, we need a new government.
Do you have a follow-up question?
Yes, I would just clarify that. So you say recruitment is the issue that is the reason for these increased wait times?
We are unable to provide more surgeries. So we can't make a dent in that list until we have the healthcare staff that we need to be able to perform those surgeries. So certainly, the COVID-19 pandemic, did that have an impact? Sure it did. Did this government make that impact worse at pretty much every turn? Absolutely, yes they did. So they bear responsibility for the situation we find ourselves in. And in the midst of that, of course, they were still busy attacking doctors, busy still fighting with them about their contract, and making it harder for us to recruit more folks to the province. So I'd say those are the big factors: the COVID-19 pandemic, which this government made so much worse; the healthcare staffing shortage, which again this government deeply, deeply magnified and made far worse. And those are our biggest obstacles, I think, to being able to truly address these wait times.
Thank you. We'll do one more pass for questions. Just a reminder, if you're on Zoom, it's the raise hand function. On the phone, it's *9. Catherine has another question.
Always have more. So I'm just trying to understand how you would increase surgical capacity. Is the idea to reopen some of those previously shuttered rooms? Is it just a matter of recruiting more doctors? Like, what is your plan to increase surgical capacity?
So certainly there are some very clear opportunities on the table. As you say, there are certainly public facilities that could be in operation. I've spoken with a lot of rural healthcare professionals over the last few weeks, and they keep telling me, we have space, we have availability, we could be doing surgeries here. But right now, we can't even offer the basics. We can't offer basic obstetrics. Women can't give birth in rural communities because we are short anesthesiologists that have been driven out of this province by the UCP. So absolutely, I think one of the most important things we need to do first is do a full review of what capacity is available in the system. And then secondly, we need to have an aggressive recruitment to make sure that we can bring in the doctors that we need to support Albertans. So we've laid that out in our family health team's proposal, some of the steps we would be looking to take in that regard. That does include, of course, looking at international medical graduates and how we can continue to streamline and open up that system to make it easier for them to come and practice here in Alberta. But those would be the first two steps. First, I think a review of the capacity in the system, certainly including some of these interesting contracts that have been signed by AHS at the behest of the UCP. But also understanding the full capacity in the public system, and then looking at immediately how we can increase the healthcare workforce to be able to increase capacity for surgeries.
Thank you, everyone. That concludes our press conference for today.
For watching, and to learn more, check out albertasfuture.ca.